So somebody's asking about fibromyalgia and B12 deficiency. So I don't know if this is like fibromyalgia and B12 deficiency month, because a lot of the patients who've been coming in here with fibromyalgia are getting weekly B12 shots from their local B12 dispenser, usually an alternative practitioner or a GP who's got an alternative bent and who's looking to make a few extra bucks on B12 Friday. And that's not a joke. We have people around here who have B12 holidays. Doctors have B12 holidays. So it's really common to have fibromyalgia and have B12 deficiencies. And the reason is fibromyalgia is a multifactorial disease, and meaning that there are a lot of different things that contribute to the diagnosis of somebody telling you you have fibromyalgia, which more or less is tantamount to them telling you they don't know what's wrong with you. And so, one of the big things that we see consistently in fibromyalgia patients, now not all, but 70–80% is that they have autoimmune thyroid disease. Autoimmune thyroid disease is a multifactorial problem, meaning it's affecting a lot of different areas of your physiology, which is why you feel so horrible and so many things are going on. You be in so many different doctors. And then that can affect gut function. It can affect brain function. Fibromyalgia patients are largely pretty stressed. It's part of the clinical picture that creates fibromyalgia, but it's also part of the fibromyalgia picture because a lot of people have been diagnosed as fibromyalgia because their doctors don't know really what's wrong with them, so they hang that diagnosis on them. So now the patient's stressed. It's like, what's wrong with me? Where is this going? What's happening? Is it going to keep getting worse? So stress and can cause your stomach to not work right. This is the most common cause of B12 deficiency. Okay, stress can cause your stomach to not work right. Your thyroid can cause your stomach to not work right, which are two huge components of fibromyalgia. And I can't remember last fibromyalgia patient that came in here that didn't have a bad gut. And so those two entities will slow down or destroy. The thyroid will slow down, and the stress will destroy the ability for you to process B vitamins. And how do you process B vitamins? B vitamins, the vast majority of B vitamins come from you having a meat-based diet, or at least a meat-based component to your diet. And so that B vitamin has to be more or less, and this is very basic what I'm saying, okay, without getting heavily into chemistry. But that B vitamin has to have something called an intrinsic factor to cleave it from a molecule so that the B vitamin can separate, go into your system, go through your intestines, and then be absorbed, and then be processed in the liver. Well, in a fibromyalgia patient, pretty much every one of those things can maybe not happen because the thyroid and or the stress, and there's more factors that could cause this, but these are the two main ones, will cause your stomach to not be able to process that whole process properly. And you could be getting so this intrinsic factor, the hydrochloric acid in your stomach won't be there. That won't activate the intrinsic factor. Now you're not breaking down your B vitamins. Now your B vitamins either are not getting broken down or they're not getting properly processed. When you have a porous stomach like that, it tends to tell your gallbladder to not work right. It tends to tell your pancreas to not work right. It tends to tell, and all of this tends to be one of the many things that can create a leaky gut. And if you have a leaky gut, now your B vitamins are being altered before they get through your gut. They're going into the bloodstream, and then the liver, where they're supposed to be processed, is either getting slowed down or by the thyroid, or it's literally being paralyzed by your stress. And so that whole system of breaking down the B vitamins in a fibromyalgia patient usually is pretty violated to some degree or another, whether it's mild, moderate, or severe. It's almost impossible for it to be violated. And again, going back to the fact that the fibromyalgia patient, what we used to call, the group that I was involved in, and what we used to call the mystery disease patient. Well, most of those mystery disease patients had autoimmune problems. And so you don't normally get just one autoimmunity. If you have fibromyalgia, I don't think I've ever had a fibromyalgia patient come here who did not have an autoimmunity, whether it was Hashimoto's or rheumatoid arthritis or autoimmune gastritis or whatever it was, parietal cell antibody for autoimmune gastritis or blood sugar issues. But you rarely get one. You really get one autoimmunity, and usually somewhere in there is a process that is also going to alter physiology. It's going to cause you to not either break down or absorb or process your B vitamins properly. So it's really common. A lot of people come in here and go, I just started getting B12 shots and it really, really makes me feel better, which is great. But again, it's a very linear way, a Band-Aid-ish way of going about it. I'm not against it because, giving people B vitamins shot that gets directly into their system and makes them feel better for a week is huge for fibromyalgia patients. And I strongly encourage it until they would hopefully get those mechanisms under control that would allow them to start processing their B vitamins right and then ultimately absorbing them properly. So yes, absolutely. I see it all the time. B12 deficiencies and fibromyalgia they go together quite a bit at a time.